This video was brought to you by the Georgia Long-Term Care Infectious Disease Educational Program, funded by the Centers for Medicare and Medicaid Services Civil Monetary Penalty Funds.
Hi, I'm Jim with the Institute for Disaster Management. You are in for a tasty treat because in this video, we're going to learn about dietary safety and infection prevention in long-term care facilities. That's some good education. Oh, thank you. Residents of long-term care facilities are often at increased risk for serious complications from foodborne illnesses. They could have weakened immune systems and just get sick more easily than healthy adults. Your facility has a responsibility to keep food safe from spoilage and contamination, in addition to the responsibility of preventing the spread of disease. Should you fail to follow safe dietary practices, bad things can happen, like really bad. Ladies and gentlemen, allow me to introduce Dr. Doom.
Thank you, Jim. When we think about safe practices related to food and long-term care facilities, I think most of us are very familiar with the possibility of foodborne illness from contaminated food products. But something recently in another state happened in a couple of long-term care facilities that we also need to be very aware of. This was actually a poisoning. A facility normally was receiving 5-gallon containers of a dishwashing fluid for their commercial dishwasher, and they essentially would use a pitcher that was normally used for beverages to pour a gallon of that into the dishwasher, which would hold a full gallon. Unbeknownst to an individual who was serving that day to residents, the resident picked up a pitcher that had that dishwashing material in it and served it as juice to residents. 2 of them died. 1 had permanent injuries. So safety is absolutely critical in our long-term facilities related to what we serve and how we serve it and how things are labeled. We need to keep that in mind.
It's critically important to keep food safe at your facility. Knowing where to look for problems is a great first step. Now, if you walked into a kitchen and saw a rat dancing on a sandwich, you'd immediately recognize that as a problem, right? Of course you would. But some problems are not so obvious. That's why we're grateful to the good people at the FDA because they've identified the 5 major risk factors which contribute to foodborne illness. Let's run through the highlights. The first risk factor is improper holding temperatures. Foods must be stored and served at the proper temperature. We're talking about refrigerators, freezers, walk-in coolers, and steam tables. You need to keep those appliances in good working order and monitor the temperatures. Next up, inadequate cooking. Don't serve undercooked food to your residents. Meats, eggs, fish, and poultry products all need to be cooked to a safe internal temperature and served at a safe temperature. Contaminated equipment is our next risk factor. This covers just about anything that touches food as it's being prepared. So cutting boards, trays, counters, utensils, storage containers, anything that comes in contact with food must be kept clean. Here's a risk factor that may surprise you: food from unsafe sources. This means that your facility should inspect your food items when received and ensure they are purchased from safe, verifiable sources. It also means never serve your residents food that was prepared in someone's private home and brought into the facility. And of course, you should stay alert to any food recalls or warnings. And the last one is the biggest, stinkiest, dirtiest risk factor of them all: poor personal hygiene. Food preparation must be done with clean hands. That means frequent and thorough hand washing. Hair nets, beard nets, gloves, and all sanitary guidelines must be followed. That's perfect. I feel sanitary just looking at you. Another critical practice in the dietary setting is infection prevention and control. Be sure to follow your facility's policies and procedures regarding proper PPE, hand hygiene, and disinfection. All of these practices, when done properly, can prevent the spread of diseases. In fact, infection prevention and control is a huge part of public health. And if something nasty is going around, we all need to work together to control the spread of disease. Be sure you stay connected to your local public health officials. There needs to be someone at your facility who's responsible for monitoring public health information and being aware of any potential health hazards. For example, keeping track of food recalls or boil water advisories. Hey, what did the tainted lettuce say to the contaminated chicken? I'm not sure. I don't recall. You get it? Like food recall? Wait, where are you going? Let's imagine you have an infectious disease outbreak at your facility. If that happens, it's important to follow public health protocols. Different diseases have different requirements for notifying your local public health department. You need to know that information, and we have a link to it below and on our website.
In the event of a disease outbreak, the way you handle dietary practices may need to be modified. Perhaps you should wear more PPE. You could be advised to change the operating temperature of your dishwasher, or you may need to step up your disinfection routine.
If your dish machine is not operating properly, then paper and plastic may need to be used till it's fully repaired and operational again. You will need a supply of these items on hand in case of an emergency outbreak. We are so keen on disinfection in long-term care that we made a whole video about it. I wear a cowboy hat in that one. Be sure to check it out. Now it's time to learn from the mistakes of others, and that's always fun. Let's take a closer look at the most commonly cited areas where Georgia long-term care facilities have had issues with food safety. Kicking off the list is maintaining hot and cold food holding temperatures. Make sure you are serving hot foods at or above 140 degrees Fahrenheit, and cold foods should stay under 40 degrees Fahrenheit. Next up, maintain holding temperatures in refrigerators and freezers. 9 out of 10 experts agree it takes 32 degrees or below for food to remain frozen. If food is not kept cool or frozen, it can allow bacteria to grow, which can cause several illnesses. Be sure your dishwasher temperatures are appropriate for the type of machine you have. You should keep your dishwasher clean inside with regular use of a sanitizing solution. Dishes and utensils should be air dried to avoid cross-contamination with a dry cloth. Be sure to follow your facility's policies and procedures for the storage of dry goods. Make sure the storage area is in good condition, free of pests and rodents, and that items are stored at least 6 inches off of the floor. Guys, hello? The ice machine can see a lot of action, especially in these long, hot Georgia summers, y'all. And the ice machine is a very common area for the growth of bacteria, so proper maintenance and regular cleaning is critical. This means washing your hands before handling that ice scoop and cleaning that ice scoop daily, if not every 4 to 8 hours. You know I love a good label, so this next one hits close to home. We're talking about repackaging and labeling of food items. One really common citation is for failing to label food, repackaged food, and leftovers. There's nothing worse than going to bake some delicious brownies and realizing that your brownie mix is actually brown gravy mix.
Why?
So dramatic. Be sure to follow your facility's policies and procedures when labeling the name of the food, opened date, use by date, and expiration date. Have your staff members check the fridge, pantry, and freezer each day for expired foods and discard them. Even little refrigerators can cause big problems.
Be sure that resident fridges and staff fridges are kept clean and checked daily for out-of-date foods. Have a log to monitor the temperatures of the refrigerators outside the kitchen, including the medication room.
Other areas of concern are foods grown in facility gardens and snacks, treats, or meals that may have been brought in by residents' family members. If it's food and if it's in your facility, it's your responsibility to be sure it's stored and handled safely. That word, responsibility, brings up an issue that needs to be addressed. A lack of clearly defined roles can lead to confusion. For example, if the ice machine is broken and contains a mysterious brown substance, who at your facility is responsible for correcting that situation? Is it dietary? Or is that the responsibility of environmental services? Or does it fall to engineering and maintenance? Everyone in your facility needs to know their roles and responsibilities to ensure the health and safety of your residents. We hope you've enjoyed this exciting video about dietary safety in long-term care facilities. We've really just nibbled at the high points, but you can find links and lots more information on our website. Hey guys, I think we've all earned a treat here, right? Thanks for watching. We'll see you next time. Did y'all see that dancing rat thing? It was all like, it's like, what?